the United States is the richest, most powerful country in the world. We have a continent-wide wealth of natural resources at our disposal. And yet, even with months of notice, we were unable to produce the face masks, the hand sanitizer, the medical equipment that we needed to keep us safe. The fact that our medical professionals and other essential frontline workers have been putting their lives on the line without adequate supplies of the things that they need to keep them safe from infection. This isn't just bad and unconscionable. This is the direct and predictable result of policies that have helped corporations to outsource manufacturing throughout the world, wherever workers are the most exploited and wherever environmental regulations are the weakest, so that they can create these supply chains that prioritize profits over all other considerations. So there's no question in my mind, that the ineptitude and the mistakes of the current administration have exacerbated problems with getting supplies where they're the most needed. But in this instance, the shortfalls in personal protective equipment and things like that were born in large part by trade policies that destroyed much of the nation's manufacturing base over a period of decades. And so I don't want to drop too much data on people, but 20 years ago, before China entered the WTO and the outsourcing of US manufacturing went completely hog wild, the US had a trade surplus in ventilators. We had a trade surplus in medical equipment. We had a trade surplus in test kits. And in the years since, those surpluses have all shifted to multi-million-dollar trade deficits. Over that same period of time, 99 to 2019, we've seen our deficits in face masks balloon 446%. The deficit in other PPE has increased 464%, and the deficit in disinfectant and sterilizers has grown 3,724%. This all according to government data from the U.S. International Trade Commission. So, these trade policies that have destroyed middle-class jobs, that have expanded inequality, that have harmed the environment, that have ignored human rights abuses, they've also made us less safe during a public health emergency. We used to be capable of making PPE and ventilators and other needed goods right here at home. But we used to have factories that might have been able to upscale production when needed. But now, due to outsourcing, we've got this situation where you have hospital workers reusing masks. States have been outbidding each other for ventilators and other medical equipment. And frankly, too many frontline workers have just gone without the safety gear that they need. And so looking forward, if we want to be able to produce things that we need to survive a future crisis, we need to rebuild manufacturing capacity. And that means rewriting our trade policies to allow for industrial policy. In other words, we need trade rules that respect countries' right to use public procurement preferences, to use subsidies, even to use tariffs to support the production of key products and the growth of key sectors. And let me be clear, this doesn't mean that we shouldn't be importing things, and it doesn't mean that we shouldn't be exporting things either. But if we want a resilient economy for the next crisis that's guaranteed to happen, we can't have these pseudo-monopolies where the whole world is dependent on one region, and in some instances, even one factory for life-saving equipment. There need to be more diverse supply chains. And related to that, decisions about where goods go in a crisis can't just be based on who has the most money to spend, right? This whole deal with states outbidding each other and countries outbidding each other for the last shipment of rubber gloves or what have you, that can't go on. Governments need to be empowered to make decisions about where life-saving supplies are the most needed and where they get allocated during an emergency. And so that's one of the big ways that outsourcing has hurt us in the face of COVID-19. I've